A troubling, record-breaking day shedding light on a crisis within a crisis. Toronto Paramedic Services responded to 40 reports of possible overdoses between Friday and Saturday morning. 3 people died. That's the most suspected overdose calls within a 24-hour period since monitoring began back in 2017. Advocates say drugs are more potent, more available than ever, and the pandemic is making it increasingly difficult to save lives.
In this weekend of this large increase in overdoses and overdose deaths, I can't be at work to provide a safe place for people.
Limited hours for safe consumption sites is one of a few reasons health promoter Matt Johnson says overdose deaths are going up during the pandemic.
A lot of the tools that we suggest to people, or strategies that we suggest to people around avoiding overdose death, doesn't work as well during COVID. So there are things like not using alone, being around people, accessing services. Well, in a lockdown, we're suggesting that people isolate and services are shut down.
Toronto Public Health says a record was also set last month. Paramedics responded to 34 calls for suspected overdoses in December that ended in a person's death. Preliminary data shows between January 1st to January 26th of this year, there were 30 fatal calls for suspected overdoses. These types of calls to paramedics were nearly double what they were in 2019, with more people dying. Early data from the Office of the Chief Coroner for Ontario says there were 823 deaths in Toronto last year, which were drug-related. That's 67% higher than the 494 deaths reported in 2019.
Naloxone, which has been our main strategy for focusing on reversing overdoses during most of this drug poisoning crisis, isn't functioning as well as it used to because we're not seeing the reliance on opioids as much. We're seeing a lot of other depressants mixed in with opioids.
Councillor Joe Cressey says all levels of government need to come together to address this urgent health crisis, just like they've been doing for COVID.
We've called on the provincial governments to fund safe supply treatment programs. These are programs in place around the world that are having huge positive effects.
Johnson says while more funding and services are desperately needed all around, the focus should also be on the root cause. He says criminalization and locking people up doesn't work, and also adds that there needs to be a safe supply.
Offer people something else. So for people who are using street drugs every day and can't or won't stop in the short term, we can offer them something so that they can at least stay alive and we have some hope for the future.
Toronto Public Health says an urgent public health needs site began operating at the Bond Hotel last month, and another one will open up at the Edward Hotel next month. This ensures that medical support will be available if somebody overdoses at one of these physically distanced hotels. People can also be connected to health and social related services. In Parkdale, Maleeha Sheikh, City News.